Our healthcare system is in crisis, and Albertans are paying the price. I mean, here we are, it's January, just out of the holiday season, a time when most of us got a chance to relax, celebrate, and spend time with friends and family. But for some, it was far from happy because they were left reaping the result of the UCP government's decisions to ignore and even try to actively cover up the deep damage they've caused in the healthcare system with their cuts and their chaos. And as a result, patients, Albertans, are suffering and they're dying. On December 22nd, Prashant Srikumar, a 44-year-old father of three suffering severe chest pains, died after waiting 8 hours in the ER at the Grey Nuns Hospital in Edmonton. On January 3rd, an 84-year-old woman, well, she slipped outside and broke her hip and had to wait an hour on the ground in the cold for an ambulance to arrive. In another story, it's been shared, a retired charge nurse who needed emergency care waited 8 hours to see a doctor. And when she did, she told him that she'd started her career as a nurse shortly after World War II, and she's never seen it this bad. And doctors agree. ER physician Dr. Warren Thirst says healthcare is in the worst state he's ever seen in his 25 years of service. Yes, even worse than during the pandemic. Because during the pandemic, we at least had leadership. People at Alberta Health Services and throughout the system who had the power to make decisions, to mitigate the harm, to try to protect you and your access to care. But the UCP took that away. They've utterly gutted our healthcare leadership. They've dismantled the coordinated, integrated systems and structures we had in place that got us through a global pandemic and replaced them with top-down control straight out of the minister's office. 4 ministers now who are all refusing to act. That's why 4 days ago, hundreds of ER doctors across the province called on the UCP government to declare a state of emergency that would allow them to fast-track funding, implement emergency staffing measures, do rapid deployment of beds and equipment between hospitals. Key stuff. And the UCP refused. The UCP had been silent for weeks, ignoring the crisis. The Minister for Hospitals and Surgical Health Services, well, he's pretty much been invisible. But in the face of these frontline healthcare workers speaking up, making a desperate cry for help, well, the UCP sent the Minister for Primary and Preventative Health Services to essentially say, too bad. You've got what you got. There's nothing else we can or are willing to do. Seriously, that's the message from the UCP, a government with 4 times as many ministers, 4 times as much bureaucracy to run our healthcare system. That this is the best you can expect. It's the best you're going to get from them if you or a loved one is in desperate need of care. Just make do, accept the results, no matter how tragic they are. And let's be clear, this is on the UCP. There is no one else in the system who has the power to make decisions or implement a plan to address this. There is no coordination because the UCP took it away. The only ones now with the power to act are them. But the fact is the UCP don't want to take action because that would mean admitting that the system is broken. And that in turn would mean admitting that they're the ones who broke it. Because let's be clear, this didn't just happen out of the blue. The UCP were warned. In late 2023, 2 years ago, doctors with the Alberta Medical Association, they saw this disaster coming and they handed the UCP a plan to get ahead of it, to stabilize our hospitals. They warned the UCP that, quote, this system is not going to hold much longer. And the UCP took their plan and tossed it. Didn't listen, didn't do a thing. Instead of taking action, they spent the last 2 years making cuts, creating chaos, exhausting healthcare workers, and undermining both the quality and the access to crucial care. They made the bed, and now they're just telling you to go ahead and sleep in it. There's no question that better is possible. We have a plan created and presented by frontline healthcare workers. Albertans should be able to access quality healthcare when they need it, where they need it. But they can't under the UCP. You know, the UCP can't ignore this crisis anymore. All of us in Alberta's New Democrats, we're calling on them to step up to their responsibility, to take action, to reduce wait times in our hospital emergency rooms, to meet the crisis with the support and the resources it needs. Because better is possible, and it's never been needed more.